Create, Build, and Manage Daily is brought to you by Centerpost Media. Let us help tell your story. Go to centerpostmedia.com for details.
Paula London Scott is the owner and CEO of Opulent Group, LLC, which specializes in offering professional healthcare, management, and team building services. Paula, welcome to the studio.
Thank you. I'm happy to be here.
Yeah, no, we appreciate your time. Who are your clients? I want to kind of start there.
My clients are actually the healthcare workforce. So it's actually caregivers taking care of others. And that consists of social workers, nurses, any allied healthcare professionals, as well as frontline healthcare workers.
We have learned over the last couple of years that this is such a vital service.
Yes.
I think our appreciation for the healthcare workers has increased, or the caregivers.
Yes.
How do you help your clients really pursue, and I love this terminology, holistic emotional well-being?
I'm a certified therapeutic recreation specialist.
Okay.
That's my foundation.
Got you.
For years, I've been providing services to patients.
Mm-hmm.
Now providing services to caregivers who are caring for those patients, help them from a therapeutic perspective.
Sure.
The same non-pharmacology treatment that I use for patients, I use it for caregivers. It helped them because it allowed them to tap into things that they enjoy doing.
Got you.
So I provide motivation and encouragement and the ability to bounce back using fun things that individuals enjoy doing. Like a nurse who may enjoy walking or doing Zumba, well, I will come in and provide training that will allow her to relax and reconnect with herself using a Zumba technique.
Gotcha.
Or a chair Tai Chi technique. The same treatments that I would apply for patients would be the same format and technique that I use when I'm talking with nursing services and social workers.
I love that, because the fact that you've had firsthand experience in working with patients,
yes,
you know the kind of toll it takes mentally, emotionally, and physically on your body. Is that what sort of transitioned you, that thought process of like, you know what, as a caregiver, I need care as well?
Absolutely. During COVID, things had changed a lot. And the healthcare workforce, especially nurses and social workers, they had to be able to treat a patient and still be able to thrive in a restricted environment. But as well as them treating the patient, they witnessed more death. So that took the joy out of the job.
Sure.
And the activities that we were providing for patients, or that I provide for patients, I learned that nurses needed it. Nurses needed an outlet to disconnect, such as music, singing, dancing. And I decided myself, as a healthcare worker, being unable to work with the patients during COVID, and my profession, I wasn't able to consult or do one-to-one training sessions with nurse managers. I found that this is going to be the target area. We're going to have to practice mindfulness. We're going to have to implement simple techniques that will allow us to keep our resilience. It will allow us to bounce back. So my passion came about when I needed caregivers to be able to be in the same mindset, to be able to take care of the patients for a better outcome. If they're coming in a bombed out mood, and we're supposed to be providing services to our loved ones or others' loved ones, then that's not going to match. So how do we get ourselves back to being emotionally stable and still providing services and enjoying where we are? And I realized 86% of caregivers are having challenging times in their personal life as well as their work life, along with them witnessing many, many losses. And they still had to keep going to work. So I felt like maybe we ought to start paying attention to the healthcare workforce, those who are caring for others, even in the communities and the assisted living facilities, and the loved ones who had to care for their loved ones while they were on COVID restriction.
Right.
These are the people right now at this time who actually need therapeutic recreation, who actually needs motivation. They need to know that they can do Tai Chi or yoga or
Just
a
breathing.
3-minute breathing
Yeah.
technique
Yeah.
right at the nurse's station.
Paula, I want to put your website up for those who are watching tonight on BizTV.
Thank you.
It's unique the way you spell it.
Yes.
Why don't you spell it for us?
Opulent.
Yeah.
It's OPEULENT. It still means the same thing as opulence. Lavish.
Add a little E in there.
Yes.
Yeah.
I'm actually.
By the way, it's Opulent Group
LLC. I'm sorry.
No, I just want to make sure I get that out
so
there.
excited about the word opulent.
Yeah.
I'm sorry. It's
No, you're good.
Opulent Group. Yes, LLC.com. I'm so sorry.
No, you're good. You're good. That's awesome. And I would think, if I'm a hospital administrator and I see so many of my nursing staff that are leaving in droves because of burnout, I'm picking up the phone and calling Paula. This seems like a good answer. Are you working with any big groups right now?
Well, lately I've been working with the nursing services. I work with the new nurse graduates. I provide stress management techniques, and I also work with former nurses in their training sessions. I usually provide simple ways of how to implement mindfulness. I show them Tai Chi. I show them dancing, 4-minute dance routine that a group of them can get together. And I'm also a member of the DeSoto Chamber of Commerce.
Okay, you're
Yes.
very busy.
Yes.
That's awesome. OpulentGroupLLC.com is a website. We got less than 60 seconds. Give us an example of one of your breathing exercises that maybe we can do at home tonight.
So, first of all, I would like to ask you to just take a few minutes
Okay.
and breathe in. Hold 1, 2, 3, 4. And as you exit out, think of the number 3 and visualize in your mind 3 times. And then we go to number 2. You breathe in.
And just kind of keep doing
Yes,
it that way.
until we count down.
Okay.
3 to 1 method.
All right, I like it. 3's my favorite number, so I thought we were just going to stay on 3. So,
That's very good.
Paula, thank you so much for coming in, and I appreciate the good work you're doing.
Yes.
Again, Opulent Group LLC, Opulent with an E after the P. We'll be back right after this.